Hi, I'm Dr. Rosie Roeder.
And I'm Andrea Sparr.
All right, we're here to talk about acne today.
Oh, goodness. This is just a big subject in its own.
This is going to be the Andy Show.
Yes. Andy Show it is. All right, y'all. Acne is not just for teens. All right, let me repeat that. Acne is just not in your teenage years.
That's right. It is something that happens in all of your lifespan. It can happen at any point. I am 48 now. So I have fellow women that are sort of getting into that perimenopausal age that talk to me about their breakouts. Mm-hmm. And I'm like, I'm going to send you to someone like Andy. But personally, when I was a teenager,
right,
I had acne. My dad has acne scars. My mom's biggest fear was that we would end up with some type of acne scarring. So my mom was diligent about getting me to the dermatologist when I was like 12 and 13, going through puberty,
right,
to get facials every other week. And I started off with the Stridex, like I think everybody else, but graduated to some other products with the guidance of a dermatologist. So it was really important to me in my teenage years to have that. So I think it's awesome information that Andy's going to give us, because she's really truly the expert now, because she does a lot of medical dermatology, a lot of acne treatments for all ages. And I'll let her tell us where she wants to start in the lifespan of things.
All right.
And I'll interject with either some personal insight or with just asking her questions that I imagine somebody like me, who's not an expert, would want to have.
Yeah, definitely. And honestly, I grew up with acne as well. Actually, being in Gaffney, growing up with acne, there's not like there's no dermatologist there. You had to go out of town to get to a dermatologist. So as a child, I did not get that. I got the Proactive from the 1-800 number on the night show, and then our Noxzema wipes. And I tell all my patients now, when I start talking about that, their parents start laughing, because that's basically what our generation had. And I tell my teenagers, it took me 30 years to get my acne taken care of. I'm 36 now, and to get things under control like that, I want them to get it under control earlier in life. And so I try and give them the easiest regimen that I can that's going to work for them, because teenagers are hard.
I have a teenage son who I've been trying to guide through the acne treatment myself. And I do have him come to our esthetician to do a few different treatments as well. And as a mom, I think sometimes we get lost even on the pharmacy aisles, and even working in a plastic surgery practice alongside dermatologists, I'm always trying to be like, what should I do for my teenage boy? Because they are even less likely to pay attention to that, I think, than the girls.
Even to wash their face is difficult for them.
To wash their anything.
No joke, I had a patient, sidebar. I had a patient one time come in, and he's like, my acne medicine's not working. And I said, well, when are you using it? And he says, when I shower. Okay, well, follow-up question, shouldn't have to ask, but how often are you showering? He says 3 times a week. Mom's jaw hits the floor. And I'm just like, okay, we need to reevaluate here. Again, less is more for most of these kids. If you give them a 27-step routine, it's not going to get done. And I always tell my patients, we're friends. You don't have to lie to me. You tell me if you use it or not. I don't want to waste your time or your money. I can't make you use it. I can't go home and make you use it. But just tell me the truth. Because again, I'm not trying to add something to a routine that we never used in the first place.
Right. And we're not really trying to shame them either, right? It took a little bit of time to find out what my teenage boy was going to do. And he loves the papaya enzyme cleanser from Revision.
Right.
He begs me to buy him that because it smells good and it's something that he will do. So that's great. But whenever I've tried to get him alpha hydroxy or glycolic acid pads to use on his face, it's just not his thing.
Right.
He's not going to do that. So I think it's just, like you said, the trial and error of finding what works.
Yeah. And I tell my boys, I said, honestly, if you can at least get it on every other night, it's like flossing. Some's better than none. We will eventually get somewhere. It just may be a little slower.
All right. So tell us how you start a consult.
So in general, especially my teenagers, so we'll start at the teenage years. When they come in, I try and explain that most of their things is due to puberty. So when they hit that puberty range, you get an overproduction of oil or sebum in your pores. And that's where you start getting these open comedones or blackheads, closed comedones, whiteheads, and then even cystic acne or deeper pimples.
Awesome.
You see it on the face, everywhere, okay? Yep. Forehead, nose, cheeks, especially boys that have the long curly bangs or girls that have the bangs and they sweat a lot. You see a lot on their forehead because stuff's getting trapped. So then I start by asking them what routine they are currently using. Some people will say, I just wash my face with water. Some people will bring a bag of everything that they've tried from the over-the-counter aisle or their mom's bought them off of Amazon. And then we kind of start there.
Okay. We're also probably going to go down the body, right? Because I see a lot of back acne.
Back and back acne, face acne, chest acne, especially, a lot of my kids, they play sports. They sweat a lot. They go to a game. They get home at 10 o'clock. They're not going to shower. They're going to climb in bed half the time with their dirty, sweaty clothes that they wore to the game because they're tired. So just adding in just one thing to that routine, either like a hypochlorous acid spray to kill the bacteria on the skin or either a benzoyl peroxide wash can help dry out a lot of the body acne in general. Wow. And they may not need a medication for the body.
You said a couple of things that I think I'm going to take home to my boys if they decide to come home sweaty.
Yeah.
Their practices. That's some good tips. What is your usual standard program for them? What are the, let's say, maybe top 3 things that teenagers should be doing?
So they need to be washing their face, not necessarily twice a day, but most of the time, just as we start, I try and get them to wash it in the morning and at night.
Does it matter if you're washing it with a prescription grade wash or medical grade?
Not necessarily. Like I tell them, Cetaphil, CeraVe, Vanicream, they are my top favorites. If you want to get a little bougie over the counter, La Roche-Posay is my jam.
I love
But
La Roche.
You can always get medical grade washes too, like the papaya enzyme cleanser. But just the gentle cleanser is what I start with because I want to know the medicine's working and not 18 other products that's interacting with them, causing them to have worse side effects.
Yeah, I'm glad that you mentioned that. And I think as a premises for anything we're going to talk about here, you have to separate things. Right. I also tell my patients that when you do too many things at once, you don't know exactly what worked.
You don't know what the problem is.
Yeah. Don't know what solved your problem. So we really need to break it down, make it simple.
And I have a whole sheet that I give them and I say 3 things in the morning, 3 things at night. We will build from there. If you are bougie and you like all your serums and your extra stuff, hold off for 12 weeks for me. Give me 12 weeks to try and fix your acne and we can always add in things that you love. And then when you add them in one at a time, if you break out, you can't use that product. Like me specifically, my face cannot handle any vitamin C. I will get pimples as soon as I start using vitamin C products.
I love my vitamin C.
See, everybody's skin's different. So that's what I say.
Although I have a little rosacea, so it makes me a little red.
Right.
All right. So we're doing a good cleanse.
Right.
And what do we follow with that?
So follow at nighttime for me that's when I add in most of my medicines because you're not sweating a lot at night. And now sometimes boys sweat a lot in their sleep. That's just inevitable.
Yeah.
But that way there's nothing major going on top of it beside a moisturizer. For my girls, if they're doing stuff in the morning, they're putting maybe 5 or 6 layers of makeup on top of it too, right. Especially my high school girls because they've seen all the new TikTok ads. But medicine, then you follow by a moisturizer. Sometimes I have them sandwich it. Sometimes I have them mix it. I tell them it's going to be a little spicy regardless, especially if their skin's not used to medical grade medication. But if they've used over-the-counter products, sometimes their skin's already tolerable to even the lowest medical grade medication that I write. But at that point, once they go to sleep, they wake up, I have them re-wash their face. Again, not always necessary, but at the beginning, I'm trying just to get a good wash in there because sometimes they're going to forget one wash or the other probably. Right. So at least I can get them washed once. Moisturize, sunscreen, and then we go from there. Now, if they are on a morning and a night medication, the medication will always go before their moisturizer. You go thinnest to thickest when you're using products. So I actually bought some of the products that I really like today that we'll kind of talk about later in another episode. I think Rosie bought some of her favorite products, so we'll definitely dive into that a little bit more. But it's all about consistency and routine, and if they can just give me those 12 weeks to see if we need to add, subtract, switch products, it's usually pretty easy to get these teenagers clear.
I use a lot of tretinoin or vitamin A to my skin when I was young. And now I use it for my fine wrinkles, textures, and other things like that.
Right.
So do you go directly to a tret? Do you use benzoyl peroxide?
So there's technically 4 pillars of acne. And like I said, most of them can be taken care of with a topical vitamin A or a retin-A or adapalene, tretinoin. They're all in that category. And what that does is it accelerates skin turnover. So what I tell patients, I said, secretly underneath your skin, you're getting all this shedding. Your skin only sheds once every month. Okay, so it takes 3 shed cycles to even see if it's going to work.
Wow.
But because it accelerates that shedding a little bit, you may notice a little worse acne. It's got to clean those pores out.
Right.
But My girls absolutely love it when I say it's a good anti-aging product long
Yes.
term. So fine lines, wrinkles, hyperpigmentation, acne, it takes care of a lot of that, and it's all well-rounded in one product.
Here's another time where my esthetician doesn't like me is because I send them over to the different gel over the counter quite frequently, even for somebody who's older who's just looking for an aesthetic product to help with fine wrinkles, turnover, collagen,
and I even have them start there just to even get their skin used to it. And then I'm like, once you're using this every night and you're like, this is not doing any more for me, then you come see me.
Right.
Then we'll get you on the next strength and the
gets,
next strength.
Right. It gets you through that first shedding because a lot of people tell me I didn't tolerate the tretinoin because I got dry. And I said, well, that's exactly what it was supposed to do.
Yes.
But Andrew's absolutely right. You need to follow that up with your moisturizer.
Yes, because oily does not equal hydrated.
It does not.
People feel like they're like, my skin's oily, I don't have to moisturize. That is not the truth. That is one of those myths that we're going to talk about later. Oily does not equal hydrated. You still have to hydrate. So that retin A or vitamin A is going to actually shrink the oil glands, so you're not producing as much. So your skin texture is going to dry. And as we age, it gets drier anyways. I tell my patients, even if you're drinking more water, your skin's kind of like the redheaded stepchild. It gets the scraps. You have to give something on the outside to help it.
That reminds me I should drink some water because the hydration comes from the inside, right? Not all from the inside.
No, again, like I said, you still will get some, but them internal organs jump on that and it's lacking on the skin.
All right. So we cleansed. We did our benzoyl peroxide. We did our moisturizer. Are there any moisturizers you think people should stay away from that are maybe too heavy for the acne patient?
Some of them are a little on the thicker side. You always want to look into something that says non-comedogenic, non-pore clogging, because when you're running into that shedding cycle, it's like hitting a door. So if that stuff can't come to the surface and shed, it's getting backed up, and that's where you're getting more acne or that milia or those deeper white pimples that you can't never seem to pop.
Yes.
Because they're thicker products, and that's usually due to thick products that aren't allowing the breakthrough.
Yeah, I was really thinking Millia in my head here. We're just like in the same wavelength.
Sinking it in. And people come to me just for me to unroof those because they're like, I've been trying to pop this for 3 months. I even set them up with the estheticians just to do an acne facial so they can unroof some of them for them too. And I say, what is the thickest product you use? And it's usually this anti-aging cream that they found in Korea or India or somewhere that they ordered, and we have no idea what ingredients are in it, or some thick moisturizer that does not allow breathable skin to get through.
So let's say you're doing all of those things.
Correct.
And you still have terrible acne and you're more in the cystic acne part. When do you go from topical things to having oral acne
So there's an
medication?
algorithm for it, and in general I always start with a topical. Some people are very reluctant to do oral antibiotics, so I try and do a second topical if it's in that category. Some people are like, I just want to rid of it. I try and do 3 months of doxycycline. I am a doxycycline fan just because it has that anti-inflammatory property behind it. That's why they used it a lot in COVID, for the anti-inflammatory property on the lungs so people could breathe. And definitely helps a lot with the redness. There's studies that show you can do it for 6 months with no issues of having a resistance to it, but I only do 3 months for acne because at that point, these kids have been dealing with this acne a while. They don't want to keep going to school with it. If that 3 month mark, we've saw absolutely no change, then we talk about Accutane, which is literally the closest cure to acne on the market.
Accutane has some potentially severe side effects, right?
It does.
And there's a lot of things that we need to do to get somebody enrolled in Accutane. Can you tell us a little bit about some of the testing that you do ahead of time and how you monitor patients to make sure that they can safely take the medicine?
So I am one of those conservative people when it comes to Accutane. I'm only going to give you what your weight allows. There's doctors out there that'll try and give you the whole dose in 3 months. It is typically a 6 month process. So you rebound hard if you try and get it all up front. So I try and tell people, this is a slow process. We're going to become friends because you're going to see me every month. There's a program that's ran by the government called iPledge that, manages this on the back end, manages the pregnancy test, the patient, all their information saying when they can have the medicine. Because in the studies, they gave these medicines a higher dose than what we typically do now. Usually when you see studies, it's like 200 times the dose that you would normally give a patient to kind of see what side effects they'll have. And I go through the list of side effects. There's risk of pseudotumor. There's risk of pancreatitis, hepatitis, issues with your cholesterol panel, which specifically your triglycerides, liver issues. You can have fingernail infections. There's multiple things. Main thing that I see in my teenagers that I put on this, chronic dry skin, obviously, because it's an oral version of that retin A that we were talking about. So oral systemic vitamin A. It is made to dry out every oil gland you have. So you're not just going to have a dry face. You're going to have a dry chest, arms, legs, back. Everything dries out, including your mucous membrane. So that leads me to my second thing, especially in the winter. When you're laying in that dry heat, people get nosebleeds because your nose is drying out. So the trick to that is I have them put a little Vaseline in their nose before they go to bed, add a humidifier in the room that they sleep in. Those little things make a difference. Vaseline for the lips. Simple Vaseline for the lips makes a huge difference from that chronic cracked. Sometimes they can get joint aches because they're getting dehydrated because it's drying out everything. Headaches because they're dehydrated. It's drying out everything. They really don't do pregnancy categories anymore, but originally it was a pregnancy category X, which means you cannot get pregnant on this medication. It can cause birth defects. It can harm the fetus. It could kill the fetus. So we have to see those female patients every month, get pregnancy tests every month. So again, this is a very safe drug when you are seeing these patients every month, monitoring their levels, monitoring their side effects, adjusting as needed. Now, I will say I've had 2 or 3 patients that I've had to take off this medication because they've had some of the worst category side effects, which are suicidal ideations, thoughts of wanting to hurt themselves or somebody else.
I mean, it's already hard being a teenager, so you can imagine that's definitely something we need to keep an eye on.
Yeah, and a history of inflammatory bowel disease that can actually flare that up. It can actually cause issues with night blindness at high doses of vitamin A, which is, again, why I kind of just stick with the good gold standard of giving it by your weight. It's usually 120 to 150 mgs per kg on these people. You can go as high as 200 if they have a lot of chest and back acne, but I don't go past that.
Wow. You know, I had a lot of friends that were on Accutane as teenagers, and it's really interesting that there's just so much behind it. And the I Pledge is really important. Right. And everything is teamwork in medicine. So it's not just the medical doctor, the PA, the provider doing the right thing, but also the collaborative team that works with it. Right. The parents are part of that team, the teen themselves in trying to self-report some of those, because I can imagine for a teenager it's really hard to basically tell their parent or to tell you, look, maybe this medicine makes me look better, but now I have all these thoughts that I never had before. Right. It's a time in their life where it's hard. They're going through so many things, right? So it's good to be able to spot that and to know your patients really well. And that goes to your first setup, that you're working with them for about 3 months on things that are a little bit less, let's say intrusive or have less side effects, so that you get to know them and, develop that relationship. And I also have heard of pharmacists that have alerted families and that they make sure that the patients have signed an I Pledge. And they're also part of your team. They're not just there idly providing you a medication. It's good that they're also doing that back check too.
And that's another reason they said, do you want to speak to a pharmacist when you pick up some of these medicines? Because they'll come out there and they'll give you some extra warnings. They're like, make sure you drink enough water. If you take it on an empty stomach, you're going to throw it up. Like those good things on having that care team. Even like additionally, like I send my patients for labs. We don't do labs in our office. I send them to LabCorp. So LabCorp handles my other stuff every month. They have to get labs every month. I check their liver, their kidneys, their white blood cell count. I check their lipid panel for their triglycerides to make sure they're tolerating the medicine well. And if we see any abnormalities, I'll get labs again in another couple weeks. We keep increasing. I either lower the dose or take them off. So that's where my collaborating physician comes into play, Dr. Venorni. So me and her will sit there and we'll lay their labs out and we'll talk about adjusting doses, stopping patients, restarting patients. Again, I've only had to take 2 off because of other issues. But outside of that, Accutane's a really good medicine.
Yeah, it really is. On the plastic surgery side, something that's very interesting about it is that because of the way that it suppresses the oil glands adjacent to the hair follicles, which is where a lot of the stem cells come from the healing standpoint, we used to be told, at least when I went through training, that we would need to stop that medicine for many months.
Yes, so they recommend don't do anything to your skin, piercings, tattoos, surgeries for like 6 months after you finish, because you run a higher risk of issue with scarring in general, because it's drying your skin out so much that your skin's thin and it's not going to heal well or rejuvenate well.
Right, correct. So the main patients that I have that come to me with, let's say, acne problems, come to me because of cystic acne that hasn't regressed, and they have one cyst here and something there. And I rarely have trouble with those patients, but we always ask, are you on Accutane? How long have you been off of Accutane? And there's some plastic surgeons that say that 3 months for minor procedures might be fine. But if you're having something to your face done, rhinoplasties, eyelid surgery, that will change, or something a little bit, more involved. So make sure to communicate that to anyone else that might be your provider, a primary care doctor, any surgeon, so that as a team, we can make sure that you're well taken care of and you don't have any other sequelas that are unnecessary, because we could hold the medicine, just delay things on the elective realm. I mean, if it's an emergency, then all things out of the water.
And that's where the knowledge of the plastic surgeon comes into play, because I actually have one patient on Accutane that her mom randomly told me she's scheduled for a breast reduction in a month and a half. And I was like, well, did you tell them you were on Accutane? She's like, oh, yeah, they said it would be fine. No. I think you need to re-ask, double check that they actually heard that you were on Accutane, because again, at higher doses and your skin's drying out more, you run a risk of issues with scarring, and it was a full breast reduction. That's a good bit of scarring.
Yeah, it's a big operation, and with a lot of scars and a lot of incisions involved. So I'm, again, more conservative. I'd rather just outweigh the risks and benefits. Sometimes the patients understand the risks, or at least they want to assume the risks. But that doesn't mean that it's going to be easy getting through the process. Right. There's a lot of hand-holding that can happen if scarring doesn't heal, if the skin doesn't heal well, if you have excessive scarring, that maybe could potentially be prevented. So, that's, I guess, my surgical 2 cents there. And every now and then I'll take out a cyst from a patient's face or back or something that hasn't regressed completely. But we have so many good medical treatments now that it rarely comes to that point. The other thing I see too is older patients coming to me saying, hey, I had cystic acne when I was a teenager and I have a lot of pixelated scars. And what can I do? So then we start talking about microneedling, which is an excellent treatment for pixelated scars. I get it for myself.
I love it.
Yeah, I love it too. Patients ask me what I do all the time. So I usually do 1 microneedling a year, just sort of a maintenance part of things. But it's great for that. It might take 6 treatments for you to get those pixelated scars better. Sometimes they're very deep, like any chickenpox scars too, same thing. You can punch them out. You can do a fractionated laser on your skin to get rid of some of that surface and do some laser resurfacing. So there's a lot of things on the aesthetic realm to leave with the sequela if for some reason you didn't have access to, or you had nonetheless had these consequences of your acne, even if they were well treated.
Now, what do you think about microdermabrasion?
I think that it's good for the surface level. I think for some people it works really well. It depends on how deep the scars are, or if you have more of the cobblestoning to your skin. I think all modalities are great. I always tell my patients that if there's very little downtime, the effects are sort of like shorter of surgery, right? Surgery is very invasive. There's a very high upfront cost, but the results are surgical results. Right. And that you can't... and the more sort of down the algorithm you go, the things that are least invasive, if your recovery is hours, 24 hours a day, 2 weeks, right? You can expect that the results are going to be a fraction of what you would expect from a surgical result. So I guess that goes back to that realistic expectation of what something can deliver. And if you're young and you have mild, I think, skin surfacing issues, microdermabrasion is a great way to start. Right. We sometimes do it for like our flaps on someone's nose and to kind of get those scars. I think it's a great thing to do. Why not start with that and see what you get out of it, because there's minimal downside, right?
I really feel like it's one of the OG surgeries for acne scarring too, because it's been around a lot longer than like the skin pin and microneedling and stuff. I've seen a lot of microdermabrasion because I worked in the OR previously. I think it works well, but it is one of those little more deeper, longer recovery things.
Yeah. So I tell everybody it's worth a try if you have something more minimally invasive, right? Right. And you start there and then you move up the algorithm if it doesn't work. That's my approach to a lot of things, but I don't think people should have expectations for something that is going to give you a quicker the more time it takes for you to get through the recovery period, probably the best the results. There's no freebies in life, there's always trade-offs here.
I tell patients it can take up to a year after getting your acne under control to see where the scarring, the pigmentation, the discoloration is going to end up, because it takes time. Skin takes a little bit to rebound, but it usually rebounds.
Yeah, it really does. Well, I think we covered a lot on
Yes.
teenage acne and maybe some of the long-term sequelae, but me being perimenopausal and having gone through having children, I think it's important that we address adult acne, maybe in a separate episode, so we can focus on that.
We can hit on that next. We can hit on that, and maybe in the late 50s or what might pop up then.
Perfect. And we also have to talk about men too.
Yes.
Right? And some of the other consequences of having cystic diseases to the face or things like rosacea.
Yes.
All right. So we'll hit that on a separate episode.
All right. And then if you have any other questions, hit our comments below, like, share. Make sure you just pass it along to all your friends. We appreciate you listening.
All right. We'll see you next time.